What is the difference between a concussion and a traumatic brain injury? Hi, I'm Dr. Zimmerman. I'm the brain guy. This is a very common question individuals have. I hear there's a concussion, but I also hear there's a traumatic brain injury. Are these the same things? Well, whenever you really break it down, a concussion is actually the most common form of traumatic brain injury that occurs in the United States. And actually, millions of these occur each and every year. The problem is, many of these go undiagnosed, and for those that are diagnosed, there's a very poor follow-through rate with getting proper treatment and evaluation. Now, you may think, well, a concussion's not severe. Well, actually, in a lot of the research, they've dropped the term mild traumatic brain injury when talking about concussions and only refer to it as a traumatic brain injury. And it's because of what we know it can do to the brain long term. Now, I'm going to spare you on a lot of the research, but one of the things I want to point out is when they look at the part of the brain responsible for learning and memory of individuals who are in their 40s and 50s who have suffered a concussion when they were a teenager compared to those who did not. What they found was that if you suffered one concussion during your teenage years, that part of the brain responsible for learning and memory is smaller compared to others who did not suffer a concussion. So, what do you think? 30 to 40 years later, part of the brain is smaller. Concussions are not mild. They are severe and they are traumatic brain injuries. Now, one other data point that I want to share with you is it was once estimated only 10 to 15% may have ongoing symptoms, but that number actually has been revised to being closer to 50% in some of the research. So what are some of the symptoms you may have that says you are still suffering from your concussion or traumatic brain injury? Headaches, brain fog, problems with focus and concentration, dizziness, sleep issues, mood changes, whether it's depression, anxiety, and irritability. Also, we have memory issues as well as problems with finding words. So there's a lot of different symptoms that you could have that could show that you are still suffering. Now, what we do is help you find out and see exactly which part of your brain is not functioning right. There are different tests that we can do, such as balance, eye tracking, and then brainwave technology. So if you would like my help to see if you're suffering from a concussion or traumatic brain injury and would like to get your life back, please contact us and we will do our best to help you do that.